Hi everyone, and welcome to the British Liver Trust webinar, Alcohol and Liver Health. It is really great that you have joined us today. So my name is Amy Caffrey and I am the Scotland Project Manager here at British Liver Trust, and I will be facilitating today's webinar. Today's webinar is going to be aimed at anyone who's worried about their drinking levels or worried about someone else's drinking levels, which could harm the liver. So we hope to give you an insight into alcohol and liver health, provide some top tips for reducing your alcohol and how to spot unhealthy patterns and some guidance to change them. We also hope to help you to understand the role of the alcohol care team, highlight when it might be important to seek external help and where to find support. So we will have a number of speakers for you today from across the UK. You will hear from Katie Ballard, who is a lead nurse at Poole Hospital. Katie will talk about Audit C questions, which will help people to understand their relationship with alcohol and potential levels of risk. There will also be a section delivered by Lindsay Chalmers, who is one of our British Liver Trust Helpline nurses. Lindsay will highlight the effect of alcohol on the liver and share some top tips for helping people to cut down. We also have a patient experience from Steve. And finally, we will have a section by Katie and Sally on what an alcohol care team does and how to access help if you find it difficult to cut down or stop consuming alcohol. So I would like now to introduce you to lead nurse Katie Ballard. So she is going to talk to you about the Audit C questionnaire.
Okay, hello, thank you everyone. So basically, as healthcare professionals, we all love an opportunity to provide information, advice and encouragement to the general public and patients to consider the positives, negatives and just the consequences of your drinking behaviour. By addressing this, we can offer support, help someone to cut down if they wish to, or signpost to local alcohol services. But first, we need to know at what level you are drinking at. Any healthcare provider you go to, whether it be your GP, your inpatient stay in a hospital, or even your dentist these days, will now ask you to complete an audit. So I'm just going to share my screen. The audit is the Alcohol Use Disorders Identification Test, and it's a very quick, self-explanatory assessment tool. Just so hopefully now you can all see my screen. This is one we fill in at our local hospital. First, as I said, it is important to know your units for everyone that completes it, and every member of staff in our hospital does know how to complete it. The questions are very self-explanatory, and we begin by asking the first 3 questions to every patient, and then if the patient scores above 5, we then continue to complete the rest of the audit. The audit was recognised by the World Health Organization in 1982, and its purpose was to identify persons with early alcohol problems using procedures that were suitable for healthcare systems in both developed and developing countries. It's useful because, unlike previous screening tests, the new instrument was intended for the early identification of hazardous and harmful drinking, as well as those of alcohol dependence. So it's not targeting when you're a bit further down the line, it's actually more of a prevention tool. As you can see, as I said, they are pretty straightforward questions, but they're actually split down into further domains. So if you look at the first 3 questions, that's actually targeted at the hazardous alcohol use, and the item content's all about the frequency of drinking. It's then broken down to question 4, 5 and 6, where it's to do with impaired control over drinking, increase of drinking again, morning drinking, and this can be indicative of dependence symptoms. So anyone that's come into this category scoring high between the 3 and 4, we start thinking about dependency on alcohol at that point. And then the rest of the questions are actually targeted at harmful alcohol use. So it's to do with guilt after drinking, blackouts, alcohol-related injuries. In our trust, we will see anyone from a score 8 and above, and then help you with whatever your individual care plan is as well. Like we'll see if you're dependent, we'll see if you just want to cut down, we want to see if you want complete abstinence, and we'll signpost you or refer you to the appropriate services to provide this.
That's brilliant. Thank you, Katie, for that. It's really insightful to understand how those work. And I would like now to introduce you to Lindsay Chalmers, who's one of our British Liver Trust nurses, and she is going to talk to you today about alcohol and the liver. So Lindsay, I will hand over to you.
So thanks very much for asking me along. I'm Lindsay, I'm one of the nurses who work here at the British Liver Trust. And we're just going to touch a little bit kind of on what Amy's already talked about in terms of units of alcohol, and a little bit there about what Katie was talking about, the audit. So what do guidelines say in terms of recognising if alcohol is something that you maybe need to address, and also possible impact of alcohol on the liver. So in terms of the guidelines, so as Amy already said, so 14 units a week. So again, just encourage you to have a sort of reflect back on your drinking, your work colleagues drinking, family, friends, kind of how does that fit in, those 14 units, how does that kind of fit in with kind of your typical drinking? Is this something that you need to worry about? So again, to reflect back on what Amy was saying, so 14 units kind of equates to about 6 pints of beer a week, about 6 glasses of medium strength, 6 glasses of medium wine, bottle of wine is about 10 units. So to reflect on maybe what you guys are drinking, I love the alcohol pops there at the bottom, the WKD days, 1.1 units glass of champagne, 1.5 units. So yeah, just have a think again. This is really about reflecting on you, what your knowledge about alcohol is, and kind of the units that you're using. So just briefly, just to kind of touch on hazardous drinking and harmful drinking. So if you were going to go to the GP concerned about your drinking, hopefully they would do the audit C with you. And if you were scoring 15 or above, then they would be having a conversation with you about your drinking, kind of a holistic appointment about looking at your work life, your home life, are you a carer, etc., etc. And then the reason that they want to kind of pop you in these boxes, hazardous drinking and harmful drinking, is because they want to think about possible consequences in terms of your physical health, mental health, and any potential dependence there. So hazardous drinking is drinking more than 14 units a week on a regular basis, and harmful drinking is drinking more than 35 units a week for women and 50 units a week for men. So again, just reflecting on your own drinking, is this something that you think could possibly be you? Okay, so to touch on the effect of alcohol on the liver. So the picture on the right there, on the left even, is a healthy liver. So nice, pink, lots of blood flow, and that's what you want your liver to look at. So as you know, alcohol is kind of the biggest cause of liver disease in the UK. So all alcohol, when you drink, it goes into the stomach and it goes through the bloodstream into the liver. Everything is, all alcohol is processed by the liver. So one of the reasons that you can get fatty liver, the first sign that the liver is under a bit of stress, is that the liver can get a bit damaged, a bit inflamed, and there can be liver cell death if you're constantly drinking and not giving the liver a break. So that develops into fatty liver. So fatty liver is kind of a buildup of fat in the liver, and that'll occur in most harmful drinkers. So to go back to the previous slide, that's people drinking, women drinking over 35 units and men drinking over 50 units on a sort of regular sustained period. And it will also develop in some hazardous drinkers. So are you drinking more than those 14 units? So to reassure you, fatty liver is reversible, and it doesn't always progress to more permanent damage. But what it is it's an indication, it's a first indication that your liver is saying, look, I'm at risk here of developing permanent damage. I cannot cope with however much you're drinking, and it's maybe time to look at ways to kind of reduce your drinking, or have a look at is your drinking a problem? So the other condition that I want to talk briefly about is alcohol-associated hepatitis. So hepatitis essentially means inflammation of the liver, okay? And that can be really mild and have no symptoms, or it can be moderate and can be severe. So if you are drinking at sort of hazardous levels, you are at risk of developing alcohol-associated hepatitis. So severe symptoms would be loss of appetite, abdo pain, so pain around the stomach and kind of the right side under the liver there, and jaundice, which is the yellowing of the skin, and you'll sometimes see it in your eyes as well. It's really important if you see that you're developing those signs, if someone says to you, I'm really worried, I think you're jaundice in your eyes, you need to seek, and you're drinking to excess, you need to seek medical advice. Alcohol-associated hepatitis can cause liver failure and can cause death. So to briefly touch on the third one there, the cirrhotic liver, and that's maybe something that you guys have heard about before. So cirrhosis is the permanent scarring of the liver. Okay, so we've gone from healthy liver, fibrotic liver, when the liver is getting a bit damaged, to cirrhotic. Cirrhotic is permanent scarring of the liver. Now, that's not to say you still can't make improvements on your health, okay? The important thing, if you had a diagnosis of cirrhosis, is that you need to stop drinking. It's not looking now on reducing your alcohol intake. It's looking on how can we best support you to stop and live an alcohol-free life. So the issues with cirrhosis are that it can lead to further liver damage and liver failure. Not everyone with cirrhosis will develop liver failure, but it can lead to liver failure, and it can lead, well, it will lead to an increased chance of liver cancer as well. So what do we do about that? So then you're under specialist care. So if you have a diagnosis of cirrhosis, you should be under the care of a specialist team at the hospital. They will look at supporting you with reducing your alcohol, and what they do is they will monitor you every 6 months for symptoms of cirrhosis. Okay, so we can't cure your cirrhosis, we can't give you something to make it go away, but we can monitor you for symptoms, and we can support you with those symptoms, either medically or through other channels. And they will also monitor you for liver cancer, and that's done through an ultrasound and a blood test. Around about 10 to 20% of harmful drinkers will develop cirrhosis. So in other reasons that alcohol can affect the liver is that the calories in the alcohol. Okay, so the first thing is it's an appetite stimulant. So I'm sure you'll all know, do you know, on your Friday night and your takeaway, and you're sneaking in for your 6th poppadom, you think, how did I manage all of that? It's because it's an appetite stimulant. If you're having your your family packet of crisps along with your cider or your beer in the evening, and you think, well, that's a family packet and that's about the whole packet gone, and that's why it's an appetite stimulant. So also the calories in alcohol. Again, I'll let you all kind of have a think about how many calories. Again, if you remember, Amy's side is in a bottle of wine. It's about 555. So that equates to about 2 cheeseburgers. So like think about your Five Guys, your Mackie D's, 2 of them, and it takes, if you're a jogger, it takes about 60 minutes to jog that off. Or if you're a beer drinker, 1 pint of beer is going to be about 170 to about 180 calories. So that's about a packet of crisps, salt and vinegar crisps. And again, if you're a jogger, that's about 18 minutes of jogging to work that off. So I think Amy showed this slide too. So yeah, so alcohol pops, again, 237 calories in an alcohol pop, the same as 3 tea cakes. And the other reason that drinking to excess can lead to weight gain is that the alcohol doesn't do anything in our body. So when you drink it, the body can't store it, it can't use it for good. All it wants to do is just metabolize it and get rid of it. So process it and get rid of it. So therefore, if it's doing that, it's putting other things, it's delaying other things. So things like absorbing nutrients, things like storing fat or metabolizing fat, that's all delayed because, like I say, the priority is getting rid of alcohol. So if it has less and less of a break, then those things are impacted. So if this has kind of resonated with you, if kind of further on in the webinar, you think, oh, do you know what, it's kind of time for me to look at cutting down my alcohol. These are just kind of some suggestions which might work for you. So firstly, don't rush into anything. Don't come away from this webinar thinking, I need to cut down on my alcohol. That's it, I can never drink again. It's not about that. It's recognizing, are you at risk? What risk am I? And what do I need to do now? So you're going to need a bit of support from that, okay? Evidence shows that you cannot do this alone. And it doesn't matter who supports you. Could be your neighbour, could be your GP, could be your work colleagues, your friends, your colleagues. Someone's going to have to support you in this. And then you're going to look at planning for change. All right, so one suggestion is to keep a drink diary for a couple of weeks and be brutally honest, which is not easy, but be brutally honest. So what are you drinking? How many days are you drinking? What, you know, if you had triggers, as it were, so what made you drink that day? Was it that the kids were doing your head in? Was it that you had a tough day at work? Was it that you had a work event and you felt unable to say no? And then reflect on that and say, okay, right, I could maybe make a change here, or I think this would be a good step in the right direction. So are you motivated and are you ready, essentially? And then thinking about those triggers. So for example, if it's really difficult to have beer in the house, then maybe buy less beer. Or if it's being out at work, then at a work event, then maybe confiding in a work colleague and saying, look, I'm going to cut down my drinking, or how, you know, can you not offer me a wine at this round, etc., etc. And then always kind of look at having drink-free days. So you should be having about 2 or 3 drink-free days in the week. If you think that's going to be a challenge for you, then think about what you're going to do during those days or evenings to occupy you, keep busy. Is it going to be that you start going to the cinema? Is it going to be that you and your partner go for a walk? Is it that you binge watch something on Netflix? What are you going to do to occupy your mind during those drink-free days? So that's really all from me, and that's the nurse-led helpline number there. We're here to kind of help support you with anything that you're worried about. If you're worried about your liver health, if you want more information, please phone us. Like I say, we have the helpline, and we have email support, and there's also an online forum which you can access through the website, and the website itself is a huge wealth of information. So I hope that's been helpful and useful for you today.
Thank you so much, Lindsay, for that. That was really useful and really eye-opening information there, I think, for people to really think about their behaviours. I'd now like to introduce Steve to the webinar, who's going to share his experience of alcohol with us. So thank you, Steve, for joining today. And I'm really glad that you've agreed to do this with me. So thank you.
No problem.
So Steve, I think just to kind of start off with, what was your relationship like with alcohol?
It started, I mean, like maybe a lot of people, at a young age, 17, 18, still living at home, going out with my pals Friday, Saturday, Sunday night, but living under mum and dad's rules. I started being at a certain time, and I obviously starting work then, so it was fairly sort of regimented. And then my work progressed, and I got a good job in the trade I'm in now, well, was in rather, the greeting card trade, and I got promoted, and I started to stay away a lot. Now, it was fine when there was a little chef next to a travel lodge, but when, of course, there was a Beefeaters and all the other restaurants in and around the Premier Inns, that's when it really started to escalate, because I'd be away from home, didn't know anything about the local news, but would find it easier to sit in the bar when I finished work, have a few beers, have a chat to people, go up, get changed, come down, have a meal. And then that habit sort of continued towards the end, I would say. When I say towards the end, I mean towards January 2020, when I was in hospital. I would say that Mine was a coping mechanism. And if I'd have approached the British Liver Trust when I've been just looking, it's the first time I've seen those slides and heard the conversation, I would have scored the maximum on every one of those, the daily drinking, certainly towards the end. Yeah, mine was a coping mechanism. And I'd try all the things. I was lived on my own as well, which is more difficult. But I'd always get the extra emergency bottle of wine just in case. And in the morning, I find that was gone as well. And obviously, it culminated in what happened to me. So it was certainly an upward curve, but then it got a lot steeper in the last 8 months.
And what effect do you think, Steve, drinking alcohol had on your relationship? So you talked a little bit about your work. It was kind of ingrained into your work life, but what about kind of family life and relationships with family members?
Yeah, I mean, I've just had 3 long-term relationships. I've been divorced a long time now. But at some point it affected, it wasn't all bad. I have to say it wasn't. I'd be telling a lie if it was, but yeah, it's affected every relationship, and certainly my relationship with my daughter, my youngest daughter, was affected fairly badly, to the point where certain things were said. And you know what happens when you're in drink, you send a text and you can't, once that text has gone, you can't have it back, can you? So yeah, it's had an effect on every relationship. One thing I can remember, went to Amy's graduation ball. She's a good dancer. Now, I thought I was okay, but she'd highlighted I had at least 3 bottles of wine that night. So even on Amy's, the thing is, I didn't think I was that drunk, but she'd highlighted it. And, you know, that was the one time I should have said, no, I'll have nothing tonight. I want to show, but 1 becomes 2, becomes 3, becomes 4, and then, you know.
And
so, yeah, it's definitely had an effect.
And Steve, when did you start noticing any symptoms that something might be wrong, that you weren't feeling very well? When did you start noticing that?
I've known for a while. I knew there was something wrong because I knew the amount I was drinking. And certainly when I finished working for the main contractor, because I was self-employed, I had more time on my hands then, but I knew I wasn't eating properly. I was probably throwing away more of the food that I bought, because I had no appetite. I didn't have any appetite, and I wasn't well in the mornings. And a lot of the symptoms that I've been watching this morning, that was me. I knew it. I did nothing about it. I thought I'd be okay. I thought I was invincible, I guess. What happened to me. But if I was I was home drinker. If I was in a bar or somewhere like that, somewhere similar, drinking the amount on occasions I would drink at home, I would definitely be identified as, see that fella there, he's definitely got a drink problem. You want to see what he drank last night and the night before. But when you're at home, you can't marshal it. And I say, you always get that just in case bottle of wine, when it's never a just in case, is it? Because invariably it's gone because you get the taste for it. And drinking red wine didn't help. I thought that'd be fine because you'd have to chill that, but of course that's not the case. It's still wine. So I've known for a while.
And did you ever feel throughout that time that you needed to cut down, or were you motivated to cut down?
I knew I should cut down. I knew it, but to me, it was the only way. That some days the days would start, and because of various things, I wanted the day to end. And if that was, I was always very smart and looked after my home and was still working, but there was certain time towards the back end of the trade admin is notoriously quiet, so there wasn't the work. So I was able to, but I knew, like I say, I knew I should sort of cut down, and I wasn't feeling right. I know I wasn't. Other people have noticed it now. They will say, well, when I saw you in November, December of 2019, you were just, but they won't tell you at the time. Very rarely will people tell you look rubbish.
And thinking about, because you have mentioned that you kind of spent time in hospital when you were diagnosed.
Yeah.
I'm just thinking, how has everything changed since then? So
everything's changed. Yes, sorry, everything's changed. Well, everything's changed for me. Everything changed. Everything changed. I came out of hospital. I was close to death. That's why I could think they were going to come on to that. Yeah, I I was 5 days in a coma and didn't know any, I've had to, since I come out of hospital in 2020, I've had to learn to walk again. I still have a walking stick now, which I have a collapsible walking stick, which I'm able to use on and off now, but I had to learn to walk again. I had to learn to dress myself. I had to get a sock slider to put my socks on. I had to learn to spell my own name properly. There were so many things, because my brain had been affected. There were so many things I couldn't do at the time. And even reordering meds, my friend had to do that for me because I couldn't get the amount of meds I was on, still on, to be fair, less than I was. But I had to get all that, and still trying to look after my home, still trying to wind down my business, still bills to pay. And then you've got to get in touch with Universal Credit and PIPs and all those other things that I never thought about when I was drinking, because I never thought it was going to happen to me. I thought I'd be okay. It was just, I'll get over it. I'll be fine. But yeah, my recovery was it has to be. It still is now. It's not easy. I mean, I'm so much, when I look at myself now to where I was a year ago, even 6 months ago, there's a massive difference. But it's not easy.
Steve, where did you look for support? So when you came home and you knew that, okay, I have to stop the drinking now, where did you go for support?
Well, the first year I really didn't look for a lot of support because I had so much other things I had to sort of try and get. But towards the back end of, I would say, sort of the last 2 or 3 months, I was looking online, and some of the prognosis, because I have cirrhosis of the liver, some of the prognosis on Google wasn't particularly brilliant. Quite scary, really. And then I looked at some videos online. They were American, they were fine, but I wanted something that I could relate to. The American videos are fine, but when you hear an English accent, you could perhaps identify with it. And so I then went on the internet, and I came across, in January 2020, came across the British Liver Trust, because I wanted to find a local support group. And then I emailed them, and you emailed me back, and I was invited to a Zoom meeting. It'd be about this time, I think last year, mid-January.
It was January 2020.
It was mid-January, and I was frightened to death. And I remember you said to me, well, come on 10 minutes before, we'll have a chat, and if you feel you want to carry on. And it was the best thing. At 50, I'm 59 this year. It's the best thing I've ever done. I'm not just saying that for the purposes of this webinar, but had I not found the group, I would have progressed the way I have as a person, because I must have looked like a rabbit in the headlights. And all of a sudden I saw all these people on the streets, my first ever Zoom, never done Zoom before. And everybody was happy and tell their story. And I was literally ticking off like I'm doing now at my settee. That's me. Gosh, that's me. That's me. Just like I had been with the slides before, thinking, well, that was me. And they would tell their stories, and I felt comfortable. And of course, I met John, he's a mentor for British Liver Trust now. And he said 3 things, Steve. He said, you've got to stay positive, which I do. He said, you've got to want to do it, which I am. And he said to me, you've got to do as you're told, which I do. And much to my mum's dismay, because when I rang her to tell her, she said, you're 50, well, I was 57 back then. She said, you've never done as you've told. But yeah, I've done all that. I've followed that, stuck in my mind, and I've followed all of that. So the British Liver Trust for me was the best thing, because it's ongoing support, and I've been involved in other things as well. I put my story on, I was asked to put my story to them, which has been on Facebook. It's had quite a nice response. So yeah.
And that it's really good to hear how well that you're doing, and how much you've benefited from some of that support. And I'm just trying to think, Steve, because we've only got kind of a few minutes left, and we could talk all day. There's so much that we could talk about. But I'm trying to think, what difference now, since you've stopped the drinking and you're feeling a lot better, what difference has that made to your life?
It's made a massive difference. I would say I don't have the hang-ups I used to. My daughter, I was in January 2021, I became a granddad for the first time. And that's been fantastic for me, because I'm daft as a brush. So, Layla likes granddad like that. And before, my daughter would never even entertain, well, you can we'll come and stay at yours. Layla can come at yours for the weekend. She wouldn't. And I get that. I'd understand that. So I've been involved, and I got involved with a group called Stories Outside. So I've started arts and crafts, which I am the messiest, clumsiest, unartistic person you've ever met. And now I've started doing all sorts of different stuff. And it's given me, when the lady was talking before, I think it was Lindsay was talking about finding things to occupy the time that I would have been drinking, and that's, I guess, what I've done blindly, really, if you know what I mean. But I've met new friends as well. They know of my condition now. They didn't initially, because initially it was aimed at, the initial project was aimed at people isolated, and people that are lonely, and I was both, because I was still very classed as vulnerable back in the start of lockdown. So lots of different things, and the motivation for me is that when I was being taken from the acute ward to the Lancaster ward that I spent just over a month on, they told my mum that I wasn't expected to live. I would class it as a coma for about 5 days. I knew nothing, and I could never put my mum or my children through that again. And that's been also the motivation for me, and wanting to grow old and play with my granddaughter and play a major part. Not easy. It's not a bed of roses, don't get me wrong, but I had no choice but to stop drinking.
Absolutely. And it's so inspiring to hear, how far that you've come in that time, Steve. It's incredible. And I've just got 2 final questions for you. So what I'm wondering is, now that you're in a good place and you're doing well, and it's fantastic to hear that your relationships with your family have improved. I'm thinking, is there anything that you look back on your journey with alcohol and kind of got a fright, or something that stuck out to you, or something that frightened you as part of that, now that you look back on it?
When I look back, I think the hallucinations, towards December and prior to that, being very ill in the morning, being sick and things like that. But just not being me, just wanting the day to start. I was always motivated, seeing 4 or 5 customers a day, and I think when I started to hallucinate and I wasn't me, then that's obviously what happened in when it culminated in January of 2020.
Absolutely. So a final question, Steve. What advice would you give to somebody who might be drinking over the government guidelines and is thinking about cutting down? What advice would you give somebody?
Yeah, the advice I would give is do all the things. I'm going to have to be perfectly honest here. Do all the things I didn't do, or say, seek help. Nobody would judge you. When I was on that ward for a month, never did I get judged. The nurses were only too willing to help. Nobody. You've seen the support that's been talked about this morning. Because admission and acceptance are a massive thing. I didn't accept and didn't admit, and I'm honest with that. I'm not proud of what happened to me. Of course I'm not, but I'm in a position now where I can, I'm not, and neither is the British law. There's not a bash over the head and you mustn't drink again. I can't drink. And I accepted that. But just get the advice. If you're listening in and it's you, or you think it might be somebody else, anything you've heard in what I've had to say for the last 15 minutes or so, or what you've heard from Lindsay or Katie, then get the advice and support and see where you go from there. And I'm sure you'll have, a good and happy life.
Thank you so much, Steve, for coming along and speaking to me today. I'm sure that a lot of people here today will be able to relate to parts of that story and feel inspired to come away and make some changes. So thank you so much.
No problem, thank you.
So I'm going to pass back over to Katie for a moment. So Katie is going to talk to us a bit about an alcohol care team and what they do and when to seek support if you should need so. So Katie, I will hand back over to you for that part.
Hi, it's actually Sally here from the Poole Hospital alcohol team. I'm one of the specialist nurses. I work with Katie. So good afternoon, everybody. Most acute hospitals have an alcohol care treatment team, and they offer pretty much the same service, identifying and managing alcohol based on our assessment findings. So it could be some brief advice, or it could be a full alcohol detox or management plan. Service differ from team to team, location and funding. Here in East Dorset, the two acute trusts have recently merged. So we are now known as University Hospitals Dorset, and we're the Poole site, Poole Hospital. And our colleagues over in Bournemouth offer a slightly different service than what we do here in Poole Hospital. Here in University Hospitals Dorset, Poole Hospital, we provide the following service: alcohol assessments, the management of alcohol withdrawal. All of our specialist nurses are independent prescribers. We have implemented alcohol screening programs for both inpatient services and outpatient services across the trust, including maternity. We offer brief IBA, we offer extended IBA, and those patients that come into the acute setting, so the assessment setting, we provide a full alcohol assessment to them and see if we can't offer an outpatient detox. So that benefits the patient, and it also benefits the trust because it saves on bed days and bed spaces. But more importantly, and most importantly, it benefits the patient. We also look at adjunct therapy. So we look at prescribing medication like acamprosate. Acamprosate is a drug that kind of dampens down the cravings alongside the psychosocial therapies. They run along together. It's not a substitute for that. We have a close relationship with our colleagues in the community. We offer assertive alcohol outreach, and they work with the high impact user group here at the hospital. So anybody who attends hospital on a regular basis, primarily because of their alcohol use, we will work with them and try and work towards alcohol treatment plans and make their lives happier and get them into treatment and exploring treatment options. We also do data collecting.
Yeah, and I think the most important thing to say is, like, just don't ever concern yourself with asking for help. Any professional wants to help you, go through the British Liver Trust, go through your GP, contact your local hospital and be asked to put through to your alcohol team. We're all happy to provide any extra support and guidance. As Steve said, none of us are here to judge you. We've heard every story possible. We've seen anyone come from any kind of background. We just want to offer any support that you're willing to have as well.
Brilliant. Thank you so much, Sally and Katie. That is fantastic. So I'm just going to move to the last part of the webinar. So I'll ask everybody, the panel, to come back on so that we can ask you some questions, if that is all right. So we've had quite a few questions come in throughout the webinar, so I'll have a look and pick out a few of them. So I think, Lindsay, I've got a question here for you. So somebody has said that most of their friends drink more than the 14 units a week and always do. This individual drinks 3 bottles of wine a week and wants to know how likely is it they will develop liver damage. So is there any advice you can give someone in this situation, Lindsay?
Great. So yeah, what I can't tell you is how likely it is that an individual will develop liver damage. What I will say is that if you're drinking, you're certain over the 14 units, you are putting yourself at risk. Can I tell you how likely it is? No. I can tell you that there are definitely some things that will play into consideration. So if you're female, if you're wee, if you're petite, if you're binge drinking, if you're not having drink-free days, genetics play into part. Also, like I was saying, you know, the calories there, if you're out with your mates and it's Saturday night and you've necked your 3 bottles of wine and then you're at the chippy, you know, we've all been there, done that. That kind of thing is increasing the risk, you know, the salt, the continued fatty diet. What I would say is for the individual to have a real think about their risk, and if they're worried, go to their GP. You know, ask them and have a frank discussion with them. The GPs are used to it, especially with lockdown and COVID. And coming out of lockdown, people are going crazy. And GPs are like, I've heard it just like exactly like everyone has said, no one is judging anyone. It has been a really tough couple of years. We've seen it all, heard it all. Go to the GP, phone us, go on the British Liver Trust website, go on websites like Drink Aware, because sometimes when you see it in black and white, like I say, like the units, it's a really difficult thing to get your head around. But if you put it into, you know, these calculators and you see it in black and white, you're like, oh, well, I can't really deny that, can I? You know, things like that kind of makes them think about it. That would be my kind of advice.
Thank you, Lindsay. And there was another question came in, because I know we spoke a bit today about, you know, the calories and alcohol and how that equated kind of in comparison to food. And there was a question came in from somebody who had given up alcohol for dry January, but they had not lost a single pound in weight and were really disappointed, and wondered why did something like that happen? Any advice?
Well, again, I can't tell you specifics. Firstly, I feel you. You would have thought you would be looking at those scales thinking maybe. So the first thing is that it takes a long time. It takes more than a month for most. You know, a month you're gonna, you know, again, it depends on the person, but depends on what are you doing to fill your time when you're not drinking. Are you eating a big dairy milk? I don't know. What's your exercise like? And do you exercise? Is it more difficult for you to lose weight because you have another health condition, you know, menopause, etc., etc. So can I tell you why you didn't lose weight? No. Am I gutted for you? Because I can appreciate how you would have looked at those scales and been really dejected. Yeah, I feel for you. So no, sorry, I can't tell you specifically why.
Thank you, Lindsay. There's a question came in about the audit C. So I don't, Katie or Sally, if one of you could answer that for us. So when would hospital teams look to use the audit questions? So how do they identify who needs to take the questionnaire? So can you kind of tell us a little bit about how you decide who gets to use that?
Yeah, that's absolutely fine. So we actually audit questionnaire any single person that presents to hospital over the age of 18. As we said, it's not always about identifying people that already have concerns. It's about prevention. So anyone that may be heading down that road, we can get in there quick. And it's shown that like 1 in 8 people actually respond well. So even if it's giving a bit of information to someone that might not even know that they are on the slippery slope, it's just making them aware. So yeah, every single person above the age of 18, we test.
Brilliant. Thank you, Katie. Thanks, Katie. And Steve, my final question is for you. So for people who are watching here today and have heard your story and, you know, are willing now, motivated to make that change, is there any kind of thing that you'd like to say to them about how you fill your time? Any suggestions or tips on what you do now that you've got more time, that you're not drinking alcohol? Yeah,
try and find something that you wouldn't normally do. I fell into the sort of arts and crafts, but it doesn't take up a lot amount of your time, and it's, you know, a real sense of achievement. Yeah, try and do different things. Spend more time with your family as well. And, you know, if you can go out and cut down and not drink, your time will be a lot better, because you won't have anybody saying, oh dear, is he going to do this? She going to do that tonight or this afternoon? So try and do different things. And for me, that's what I've done. And I try to look forward. It's very easy, and it is. I do feel incredibly guilty about what happened and what I did, but now I have to look forward, because I can't change that now. That's done. I have to look forward now. So look forward and set yourself goals of doing things. I mean, I'm restricted with exercise because of this other condition that I have now, which is unrelated, but I work around that. I still do things. I don't, sit and do nothing all day, which is not easy. It's not easy for me. I mean, I've always been sort of quite busy in mind anyway, but yeah, try and do different things and don't matter. And if you mess up, it doesn't matter because no one's judging you. No one's judging you, not a competition.
Absolutely. Thank you so much, Steve.
All right. Okay.
So I would just like to wrap up the webinar. So I would like to thank all of our speakers today. You've been absolutely incredible and really insightful. So thank you so much for coming along to support the event today. For anyone who hasn't been able to come, this will be available on our YouTube channel later on, so people can come back and watch it if they wish to. I would just like to highlight some of the support services available at British Liver Trust that I know Lindsay has highlighted earlier, and Steve as well. So we have a nurse-led helpline, which is open Monday to Friday. So we will send an email around after this webinar to everyone who's attended with some of our links to our publications, our website, and our nurse-led helpline as well. We also have a virtual support group for anyone affected by alcohol liver disease, which is a brilliant group. So anyone who is worried, please do come along. As Steve said, we're all very friendly and you will fit right in, no problem. I just want to finish by saying, do look at our website. There's so much information up there. There's patient stories, our helpline service numbers, virtual registration link to join the groups. And we really hope that anyone who's come here today has learned something and is going to take some of the advice on board. So thank you so much for joining us this afternoon and enjoy the rest of your day.